today we remember what we finished in our lecture on Monday. That's the last bit that's going to be an exam next week. Okay? So today we start talking about the physiology of bone. We're going to start with a conversation about the cartilage. So things to know about cartilage, skeletal cartilage. No blood vessels or nerves inside the matrix. Blood vessels are found only in the perichondrium, which is the dense, irregular connective tissue, and I want to remind you that we can sort of illustrate cartilage this way. So on the outside, okay, it's a perichondrium. So two layers. And between two perichondrium levels is the layer matrix. Within the matrix, you're going to find lacunae, those are lacunae, and within each lacunae you will find the cells that form cartilage that are called chondrocytes. Okay? So you don't need to know which the chondrogenic versus fibrous are. I'm not really focusing on that. I do want you to know the difference between three types of cartilage that can be found in the human body. We have hyaline cartilage, elastic cartilage, and fiber cartilage. So if you look at the image of that skeleton, you can see that the elastic cartilage is found in the external ear, and another location that is not highlighted on the image is the epiglottis. Well, actually, it is highlighted right here. Okay, epiglottis. Then we have fibrocartilage. Fibrocartilage is found in the locations which experience severe compression forces. So it's going to be pubic symphysis. That's your elastic cartilage. Let's make it more elegant, so to say. So your fibrocartilage is found in pubic symphysis and in your intervertebral discs. Everything else is hyaline cartilage. So when you study for the locations of the cartilage, the easiest way to do that, everything else is elastic. Sorry. Mixed up a little bit. So when you study for your cartilage coverage, you can memorize where elastic is found, which is easy, ear and epiglottis. Where fibrocartilage is found, which is also easy, intervertebral discs, pubic symphysis. Oh, I forgot one more about fibrous cartilage, menisci. Okay, menisci in the knee. Bless you. And everything else is hyaline cartilage. Okay, doing all right so far?
If it
it depends. You're talking about meniscus?
Yeah. Like
The short?
Like up or down, does it regenerate?
No, it doesn't. It doesn't regenerate. It is repairable, but it depends on the degree of damage. So there are two modalities for the growth of cartilage. One of them is oppositional growth. Okay. So in oppositional growth, as you may actually see in these illustrations, you have chondrocytes being located immediately next to the perichondrium. These chondrocytes that are near perichondrium deposit new layer of matrix. You see the dark blue, that's matrix, okay? New layer of matrix is deposited immediately next to the perichondrium. Okay? So this is why it is called oppositional. So it poses new matrix next to the perichondrium. All good, everybody? And then the second type is the interstitial growth of cartilage, which is shown on the bottom picture. In interstitial growth, chondrocytes are located deep within the cartilage matrix. And you can see that what happens, chondrocytes divide, and each of the daughter cells starts producing new matrix. So the term interstitial, inside the tissue, okay? Questions about the cartilage so far? Okay, excellent. Now we can move on to bones and to their classification. So first of all, bones can be classified based on their shape. Bones can be long, short, flat, and irregular. Now, let's define them. We actually can categorize all 206 bones that are found in the human body right now in a fairly short period of time. So, long bones, such as femur, all bones of the upper and lower limbs, except for patella, tarsal bones, and carpal bones. Tarsal bones form the dorsal aspect of the foot, and carpal bones form your wrist. Okay? Every other bone in any limb is a long bone. You will see why this is important, because the structure of a long bone is different compared to other three types. Then we have short bones. Short bones are cube-shaped bones, so it's going to be wrist and ankle, yes, patella. And there are sesamoid bones that are found usually in the skull, but we're not going to focus on them a lot. Then there are flat bones. So, in short, your entire rib cage, which is sternum and ribs, are flat bones. Okay, in addition to that, scapulae are also flat bones, and the bones that comprise the cranium. Okay? And I want to emphasize the cranium, not the face. The cranium that houses the brain. Okay, so we're going to talk about those flat bones. Finally, we have irregular bones with weird shapes, So, vertebrae, sacrum, hip bones, and some bones in the face, such as ethmoid, sphenoid, mandible, and maxillary. I will 100% ask you to pick. Like, it's not going to be something out of ordinary, but you should be able to identify all those 4 different types. If I give you bone, I tell you now. Vertebrae, what type of bone is it? And you tell me that it's an irregular bone. Then another term that you need to know, axial skeleton and appendicular skeleton. So axial skeleton consists of skull, vertebral column, and rib cage, and on the skin on the left is not highlighted in any way. Appendicular skeleton, which consists of 2 girdles, pectoral girdle and pelvic girdle, and limbs, on that image, it's highlighted. You can see that it's the color of the girdles and the limbs is different. Okay, now what about bone functions? Well, obviously, bones are critical, first and foremost, for protection. Thoracic cage protects your heart, lungs, and other organs in the thoracic cavities. Brain is protected by cranium, spinal cord is protected by the vertebral column. Movement. Skeletal muscles use bones as levers. That's it, period. Bones is a very important mineral depot, mineral storage. If your body is short on calcium, it's going to take it out of your bones. If it's short on magnesium, it's going to take it out of your bones. If it's short on phosphorus, which it usually isn't, but you know, it can take it out of your bones as well. We often underappreciate that, but bones, specifically medullary cavity within the long bones, not medullary, sorry, specifically spongy bones in adults, contain red bone marrow. This is the place where blood cells are created. Okay, makes sense, everybody? Okay. And interestingly enough, you can consider bones being a site of energy storage. We're going to talk about it more. Adult long bones contain a fair amount of what's called yellow bone marrow, which is fat. So in our discussion of bones, we will start with the conversation about the chemical structure of a bone. If you give me 1 second. Questions? You go ahead. Yeah, that's better. Okay, excellent. Not really, because the enamel that covers the teeth is harder than a bone. Within the tooth, the structure that is similar to the bone is dentin. So, again, let's talk about chemical composition. Structurally, in the bone, the cells, let's try to draw this. So let's say this is your cells called osteocytes are within what's called a lacuna. So the blue stuff is osteocyte. Black circle represents lacuna. And the area that surrounds that lacuna is called matrix of the bone. So matrix consists of the bunch of carbohydrates, proteoglycans, glycoproteins, and collagen fibers. In fact, collagen is the main protein component of a bone. Now, these... Yeah. So, when you start looking at these collagen molecules here, you can see that they are connected by intermolecular crosslinks that eventually mature. So what is the purpose of these crosslinks? So let me give you a highlight of this. This is going to be schematic, folks. Don't take it as like the actual anatomically correct, chemically correct thing. So let's say we have two collagen fibers that are connected by these crosslinks, okay? Crosslinks that also are known as sacrificial bonds. What happens when somebody sacrifices? What happens during the sacrifice? Something, yes, something is given up, right? So here's what happens. Imagine that you apply some bending force on the bone. Right? Bending force. Can you say that you need to use some energy to produce that force? So effectively you apply some energy. Okay? Can the force break a bone?
Yeah.
Yes. Now, in order to, but if this force, aka energy, will be used to break something else within the bone without actually damaging it, you can prevent the fracture. Does that make sense? So what happens, effectively, is that these sacrificial bonds, the crosslinks, this force destroys them first. So your collagen fibers, are they connected? No. Is that a huge problem for a bone? Not yet. Does that make sense to you?
Yes.
Now, it's not unlimited, obviously. Like if you will grab my arm and try to bend it, you probably will not succeed. Okay? If you will put it on, some kind of like this and jump on it, hit it with a hammer, you can break it because there's too much energy applied. Those sacrificial bones cannot deal with that amount of energy over that amount of time. Am I clear? Now, proteins are not terribly hard. So what gives the hardness to the bone? Calcium crystals around collagen. The strict chemical term for that salt is hydroxyapatite. I'm not particularly hung up on you knowing that chemical term, but knowing that calcium determines bone density is quite important. Now, on that note, I wanted to propose, if you have kids, it's actually quite a fun experiment. Okay? Unfortunately, we don't do it. We probably can. I can ask a lab assistant to give us everything we need for maybe even today, but definitely on Monday. Okay, it's a pretty cool experiment. So I'm going to tell you how to set it up. It's a great way to show kids how scientific experiments work. You know, and you can show them, you can tell them, let's propose hypothesis and see if our hypothesis is correct. So let's say you have 3 bones. Sorry. You have 3 bones. Bone 1, bone 2, and obviously bone 3. Now you may want to ask, you know, where do we get those bones? The ideal one, drumsticks, chicken drumsticks. Like, get 3 raw drumsticks, clean them from meat and tendons as good as you can, just scrape them. Okay? That's going to be your 3 bones. So you can put 1 bone in water. And you can leave it there. Okay? You need to mass. Okay? So you need to weigh them individually. Right? So you know they mass before the treatment. Are we good? Put it in the water. We put another one into bleach, which actually is fairly basic, and the third one, put it in vinegar. If you want to add some extra oomph to the experiment, I can suggest using the 4th bone. No, wrong way. Okay. Bone 4. Put it in the orange juice, for example. Or, I have a better idea, put it in a Diet Coke. Now, a little comment. You can see that I do not capitalize the word Coke. After 8 years in Louisiana, a Coke is the same as a pop here, or soda. Everything that is soda, for me, it's all a Coke. Fanta is a Coke, Sprite is a Coke. So it doesn't matter which one you use, they're all pretty acidic. Okay? And then, leave them for, when I say more than 3 days, 3 days is fine. Okay? So here's the question. Since I told you to weigh them all, what hypothesis would you propose?
The weight is going to change for all the...
Well, hypothesis should state something. It should state that, like, weight is going to change the most in blah group. Which treatment will change the weight the most? What do you think? Bleach? Because I know the results of the experiment.
I think 2 will make them like bigger, and 2 will make them smaller.
Say it one more time.
I think 2 will make them bigger, and 2 will make them smaller.
3.
No. 2 of those. Will
Okay. Well, you have to define which ones. You have to be very
I think the bleach and the vinegar will make it smaller,
lighter.
and
The water and
Diet
Diet
will
Coke.
make it bigger.
So Shania actually, she kind of gave the results of the experiment away. So if you put a bone in water, the only thing that you can get in return is a nasty smell because you can't clean it properly. But other than that, there's going to be no change in mass. For bone and water. Bone and bleach.
The bleach you will.
Almost none. Almost no change in mass. Yes. Believe me, almost no change. Huh?
I gotta do this.
Very small. You will notice, let's say if you started with, say, 20 grams, you're going to get to maybe 19 or 18, but it's going to be a very small change. But the bone itself will become very fragile. Yes, and we will explain why. So it will be it will be much more brittle, much more fragile than the regular bone. Now, in these cases, I'm not gonna tell because we never tried Diet Coke. I can't tell which one will change the mass more. But significantly decreased weight and the bone becomes soft. Bless you. Okay, so let's talk about it. Honestly, are you surprised that water did not have any effect? Just no. Now, vinegar and Diet Coke, what's common between those two? They're acidic. So acid makes the bone very soft. What does it remove then out of the bone? Which component, chemical component of the bone? Calcium, yes, it removes calcium, and this is why the bone becomes soft. It removes a lot of calcium, this is why the weight goes down. Okay? It is a very similar idea, just the reason is shell, and I'm going to, for the record, I'm going to repeat your question. So the question was, is it similar to placing an egg in the vinegar to dissolve its shell? Yes, but the shell of an egg is just calcium carbonate. It's pure mineral, it's pretty much there's no protein, so you can completely dissolve it in vinegar or Diet Coke. Now, this contains protein, so when you remove calcium, what you have left is collagen. Okay? This is really cool, especially for kids, because you can ask them to try and break this bone, the bone with water, and they can't. Or they can, but there's a lot of effort. And then you tell them do the same to the bones that were treated with acidic compounds, and they will bend it. It bends into a circle. Okay? Now, what about bleach? If acidic compounds remove calcium, what is the second most important component of the bone? The component that gives it the resilience to tension and compression? Nope. Huh? No, not the not the potassium. No. Collagen, tensile strength and flexibility. Bleach will slowly, because collagen is the protein, it takes a while, it will destroy collagen. And this is why bone becomes very fragile. Because all you have left is a bunch of calcium. Okay? Now seriously, do it. So it's a really cool experiment, and I will ask if we have the resources for it. Can you speak louder a little?
I said the experiment that you just explained.
It's in relation to the chemical structure. Yes, chemical composition. Now, these are cells that comprise the bone, and we're going to start. I didn't properly, put them in a table, so I will have to go back and forth. So first type of cells is osteogenic or osteoprogenitor. Here. These cells are stem cells. And those are the only cells in the bone that can divide. In other words, the only cells that are mitotically active. So, osteoprogenitor or osteogenic cells do divide. When they divide, now, do you remember the terms that we used before? Differentiation and proliferation? Yes? Just a reminder. Proliferation, making more. Differentiation, becoming more specialized. So these osteogenic or osteoprogenitor cells become more specialized and develop into osteoblasts. Okay? The function of osteoblasts is to produce bone matrix, produce osteoid. Effectively, osteoblasts are building new bone. Now, imagine an osteoblast being a bricklayer. Imagine I am an osteoblast. I am a bricklayer, right? So I lay this bone matrix outside me. So again, I put those bricks, the matrix, around myself. Will I get trapped eventually? Yes. When osteoblasts lay this matrix, they eventually become trapped. And when they are trapped, the empty space in which they're trapped is called a lacuna. And osteoblasts develop into osteocytes. Osteocytes, just like osteoblasts, cannot divide. And unlike osteoblasts, osteocytes do not produce matrix. What they do instead, they monitor and maintain bone matrix. As far as I can tell, pretty much everybody here writes things. Yeah? It's fine. Any lefties? It's fine. So, all right-handed, that's easier. Look at your right middle finger. The lateral side. The side that is closer to your index finger. Is there a little depression and a little bump on your middle finger? Yeah? This is your osteocytes in your phalanges responding to the pressure from the pen that you hold between your index and middle finger. And that mechanical pressure drives what's called the bone remodeling, the change in shape. That mechanical pressure is sensed by osteocytes. Does it make sense to you? Now, one more question. You see that osteocytes have this kind of weird little extensions. So it's not dendrites, but what do you think this extensions will be used for? They're almost like hands. Say again? No, it's not grabbing. Remember, they trap. Like, I am trapped. I'm osteocyte. I'm trapped in my lacuna. But when I do this, what can I reach? Exactly, another osteocyte. So these projections enable osteocytes to communicate with each other. Make sense now? So these three cells, osteogenic, osteoblasts, and osteocytes, all belong to what's called the same lineage. You can think of a lineage as a family, you know? Like a grandfather, osteogenic, a father, osteoblast, a son, osteocyte. Does it make sense to you? Go ahead.
So when the on the picture, is that the order that it usually is formed in?
Can you say it again?
The picture, is that the order that they're formed in?
So you're talking about my arrows?
Yeah.
So think osteogenic cell develops into an osteoblast. Osteoblast produces matrix
Right.
and eventually develops into osteocyte.
Okay.
Now, what about the fourth type? So the fourth type is unrelated to these three. These cells are called osteoclasts, and they are the product of differentiation of macrophages. The name macrophage, obviously a compound word. Okay, what does it mean? Macro, what is macro? Huh? Big. Phage. Okay, are you familiar with the term? The only one that I can think of is coprophage, and it's not a good term. Okay, I'm not going to torture you. Phage comes from Greek word that means to eat. Macrophage is a baby eater. Okay, no, seriously, macrophages are large. They are the largest blood cells. And when they form osteoclasts, actually several macrophages fuse. This is why you see these multiple nuclei within the cell. Okay? And as any eater, this thing eats bone. The process of bone eating is called a bone resorption. Now, remember the chemical composition of the bone. Two main elements, right? You have proteins like the matrix thing, collagen and other stuff. And you have calcium. So when macrophage eats, quote unquote, resorbs bone, what does the body want to get out of the bone? If when it eats, it destroys the bone. Remember, bone is composed of proteins and calcium. What do you think body gets out of that destroyed bone? Which product of destruction the body cares? Calcium. Yes. So your bones are resorbed to get calcium. Now we're getting into, doing the next level. So we figured out the chemical composition. We figured out the cells. Now we're going to figure out the structure of so-called compact bone. On your tables, and let me see if... So, compact bone has another term, which is lamellar. So the basic building block of a compact bone is the structure called osteon. In this image you can see multiple osteons. For instance, this circle here is obviously an osteon. That's not it. That would be an osteon too, and that would be an osteon as well. Okay. Now, these osteons are cylindrical structures that are parallel to the axis of the bone. So they are parallel to the axis of the bone here. And each osteon consists of tubes that are nesting one inside another like Russian dolls. Okay, those concentric tubes that form the cylindrical osteon are called lamellae. Make sense? So here, it's not a great model actually. I'm going to leave it here. Yeah, those are lamellae. Okay. Now, if you will look at the direction of collagen fibers in the adjacent lamellae, they run in different directions. Why is this important? So imagine that you have one lamella and the collagen fibers in it are directed that way. And then you have an adjacent lamella and collagen fibers in it are directed that way. When you start twisting the bone, maybe you are twisting in that direction. I have to do it in two-dimensional projection instead of three because it's a screen. But, okay, your purple ones, or whatever, these guys, they will give in to twisting. But the dark blue guys, or violet guys, will oppose the twist. This is why bones are so resistant to twisting forces. You really have to produce a lot of effort to induce a twisting fracture. Okay? In the center of each lamella is a central canal, also known as a Haversian canal, which contains nerves and blood vessels and lymphatic vessels. And you can see Haversian canals, or central canals here, okay, the side view. You can also see that those canals are connected to each other by horizontal perforating canals. Okay? You good so far? Moving on, because I'm going to add more images in the next.
Can you put that down slowly?
Yeah, I can put it up, yes.
Okay, I'm good.
So, if you will take a closer look at the lamellae, you may notice these little structures kind of crammed between two adjacent concentric lamella. And they look like oval, right? With these little projections. Am I making sense? Did we see a cell that looks kind of like this? Just recently? Yeah? Yeah. That's osteocyte. So these guys are osteocytes. These are all osteocytes. Now remember how osteocytes are formed. They're basically osteoblasts that were trapped within the matrix. Correct? So, are there empty spaces? Yes. So, these osteocytes are trapped within lacunae. Okay? All those osteocytes trapped within lacunae. Now, as we discussed before, osteocytes extend those projections to communicate with other osteocytes. So these projections have to be within some kind of a channel, maybe. So these traces here, these little channels, they really, I can't enlarge the image. Okay, I'm trying to. No, can't do that. Yes. So these projections are housed within the small channels called canaliculi. Okay? So the function of these canaliculi is to connect osteocytes to each other. Effectively, canaliculi connect lacunae in which osteocytes are sitting. Now, in addition to this concentric lamellae, you may notice something else. First of all, you may notice interstitial lamellae. Let's see if I can put the text. Yes. So you may notice interstitial lamellae. Okay, so those are leftovers from bone remodeling. Your bones are constantly destroyed and rebuilt back. Okay? And that's what's happening. So those are leftovers. And finally, you have circumferential lamellae. Okay, so now circumferential lamellae run around the bone. They run around the bone, and they provide additional resistance to twisting forces. We're good? See again? What your question is about what?
The circum.
Okay, let me clarify that because I wasn't clear. So this is the osteon that consists of several concentric lamellae. Understood? This is another osteon. Understood? This gap isn't empty. It's a leftover of bone rebuilding. This is interstitial lamellae. These layers, not this, sorry, I'm bad. Hold on, I don't want to confuse you. Okay, this layer here is circumferential lamella. It runs around the entire bone, encircling it, and provides additional resistance to twisting. Okay? Double check. Okay, now the important part that we never had a chance to mention, but it's really important, is periosteum. This is clinically relevant. So, this here, the periosteum, it's a connective tissue. Okay, you can see fibrous layer, right? So what is the purpose? Let me rephrase it. What is the purpose of periosteum covering the bone? What do you think? No. Say again? No. Bones are not really flexible. What is attached to the bones in the human body? Say again? No. Well, that's, say again? Muscles. Ligaments, sure. But in order to attach a connective tissue to bone, you have to have like another layer of connective tissue already attached to the bone. Basically, periosteum is the place, the tissue that muscles are attaching into. They fuse with the periosteum. Why this is clinically important? Are you familiar with shin splints? Another term for this is periostitis. In periostitis, the periosteal layer detaches from the bone, which is very painful. And the only way to tie it back down, how do you treat shin splints? Huh? Sure, you don't run, but that's part of the solution. You want to heal as fast as you can. If something has been detached, you have to retouch it, and in order for it to attach back, what do you need to apply? Pressure. You have to apply pressure. pressure socks or pressure sleeves. Now, quick comment. First of all, you will see patients with peristitis. Quick comment. If you ever participated in any more or less long distance run, runners, and I am a runner, well, at least used to be, I don't run as much anymore. Runners are one of the most obnoxious crowds in the world. How do you know, like, a runner, a vegan, and a CrossFit athlete walk into a bar? How do you know who's who? They tell you. Yes. So, but when you see a runner, runners have a lot of bells and whistles. About 90% of them are absolutely useless or can be easily supplemented by a cheaper alternative. But as a runner, I can tell you, compression sleeves or compression socks, that's not opposed. On the long distance run, that's a necessity. You can end up with shin splints.
Is that where they wear the KT tape?
Oh no, KT tape is bullshit. It's a complete, studies show that there is nothing. No. Kinesiology tape is. Okay. Now, that was compact bone. Compact bone can be found as the outer layer of every bone in the body. When you're looking at these bones here, on this model, compact bone is on the outside. Okay, see that? Number 5. Inside of the bone is an organ. There is spongy bone. Spongy, or sometimes it's called trabecular. So spongy bone consists of the network of rods, let's call them rods, called trabeculae. And if you look at the cross-section of a trabecula, okay, this is the cross-section of a trabecula right here. So what you're going to see are lamellae, concentric, just like in the compact bone. You're going to see lacunae, which contain osteocytes. Osteocytes will be connected to each other by canaliculi, those small channels. But one thing you're not going to see, and this is the central canal. Spongy bone does not carry central canals. And in compact bone, central canals are the places where you can find blood vessels and nerves. But blood vessels, let's focus on blood vessels. So does it mean that spongy bone receives no blood supply? No. Blood vessels that supply oxygen and nutrients to the spongy bone are located within the red bone marrow. Right now, if I take the needle and stick it into any place in your bones where spongy bone can be found, for instance, the head of humerus, first of all, it will be very, very painful, and second of all, I will find a bunch of red bone marrow. Okay? So this is where blood vessels that supply trabecular bone are located. We good so far? No, we're going to talk about where in the body you can find spongy bone actually right now. Okay? So, sure, yeah. Tell me when I can move on. More?
So when they do bone marrow transplants, are they taking a specific one, or are they just taking both?
If you have a patient for like about 4 minutes, I will answer your question. Okay. Because I will have an image to illustrate. Moving on? Yes?
Yeah.
Okay. So far, hear me out. What we have learned. We've learned quite a few things about bones. We learned that there is a shape classification, short, flat, irregular, long. There's a structural classification, compact versus trabecular. Now we're going to see how this flat, irregular, short, and long bones are organized. So we're going to start with, first three: short, flat, and irregular. One word that can describe it is a sandwich. If you look at this image, you can notice that compact bone comprises the outer layers. Okay, sounds good? And in between those layers is the spongy bone. Look at this image and tell me, do you see any fairly large, noticeable, macroscopic cavity in this structure that I just highlighted?
Yes.
Clear. Macroscopic cavity. The space between the compact bone layers is completely filled with the spongy bone. Am I making sense? I'm not talking about those little gaps. No, I am not talking about this or this. That doesn't qualify as a cavity. It's filled with bone marrow. Okay? Does that make sense? Now, if you look at the compact bone here, look what you're going to see. First of all, you're going to see that it has sort of different layers. So we've got the epiphysis, proximal, and distal. I'm going to examine you on your knowledge of anatomical and directional terminology. In what proximal versus distal, what does that mean?
Proximally close, distally
Farther
away.
from the
The sharp.
connection to the trunk, right? So remember, all long bones, the one that we're talking about now, are found in your limbs. That's it. That's the only place where you can find long bones. And each of those bones have one end closer to the attachment, to the point of attachment, and one end farther. Would anyone venture a guess what bone we are looking at in this image? Femur. It's a femur. So this, the upper portion, is the head of the femur, therefore proximal epiphysis. It's closer. Clear? And another end is distal. Now, the central part of the bone that contains what's called a medullary cavity is called a diaphysis. The gaps between the epiphysis, well, not the gaps, but the area between the epiphysis and diaphysis is called metaphysis. Okay, so far, all good? Now, if you will look at, and I strongly encourage you to open up the bones that you have on your tables, you will be able to find, let me grab one. When you open it up and look at, well, it's not, okay, a little bit, it's not, it's kind of faint. Look at the distal epiphysis. You can see a pretty faint line that is different from the rest of the bone. Okay? So this line, called epiphyseal line, is what is left of so-called epiphyseal growth plate, the part of the growing bone responsible for the bone being longer. Okay? Now, you may notice that in this picture that you're looking at on the screen, spongy bone is located entirely in the epiphysis and metaphysis, and there is no spongy bone in the medullary cavity. Okay? So effectively, your long bones have a big cavity in the center. Why? What is the evolutionary purpose of having a cavity rather than to fill it with, say, spongy bone? Say again? Louder.
So it's lighter?
Say again?
Lighter?
Lighter. Lighter. Yes. It's weight. It's about making skeleton lighter. Okay? Now, what's inside that cavity? Well, if you're an adult, it's a yellow bone marrow, which is fat. If you want to make a really, really thick broth, like very thick, for soup, I don't know, would you throw just meat or meat and bones? Meat and bones. Meat and bones. And preferably long bones. So if you're making, for example, take a really, really thick chicken broth, throw some drumsticks. Okay? Because they are long bones. Am I making sense? And I don't know about you, when I was growing up, my dad had a habit of, when he would eat chicken, he would clear it out to the bone, then break the bone, and suck the fat out of the medullary cavity. It's fat.
My grandmother chewed the bone and sucked it out.
That's
and spit
Yes.
it out.
Huh? It's fat.
A
It's
lot of
simply
old
fat.
people do.
Yeah, it's simply fat. Okay? It's very nutritious.
That's what they say.
It is very nutritious. I don't know how it tastes because I don't really like it as much. Now, what if you're a kid? What fills up the medullary cavity? Well, in kids have to produce a lot of blood cells. Yes. So as we grow up, it is being replaced by yellow bone marrow. Okay, does that make sense? Now the ends of the bone in the adult are covered with the articular cartilage. Articular means that there's a communication, there's an articulation somewhere. And as we mentioned before, your bone in its entirety covered in the periosteum.
What kind of bone is this?
This one? This is femur.
Why do
A
kids
human?
have,
Probably. Yeah. Say again?
why do kids have the red marrow instead of
Growth. A lot of, like, they need to expand the blood pool all the time. They need to make more and more blood cells, and like, they still grow, they're still developing, they're just becoming bigger. That's the only reason. It's maturation. Eventually, like, as an adult, you don't need as much production of blood cells as a kid. So, to your question, if somebody gets bone marrow transplant, where do they take bone marrow? So I'm going to ask you, from sort of the quote-unquote quality perspective, does it matter? What do you think? Whether you take it from like a shoulder, a hip, a sternum,
Yeah.
it doesn't.
No, your bone marrow is
The only reason where for bone marrow for a transplant, where is it taken from? More specifically, which bone? So when a doctor needs bone marrow to carry out bone marrow transplant,
They leg.
the femur. Why? Because it's big. There's a lot of bone marrow. That's it. That's the only reason. It's easy to access. It's big. You're not going to miss it. It's very painful. Obviously, there's anesthesia, but from what I heard from folks who went through it's not a pleasant procedure when they take it. Okay? It's a head of femur. Exactly this. This part. Okay?
And that's where your hip is attached, right?
Hmm?
Your hip is attached to your hip?
Yeah, that's the hip joint. Now, we've already talked about periosteum. So periosteum is attached to the bone by so-called Sharpie's fibers. They are in the text, but not in the image. So perforating the Sharpie's fibers are attached. So periostitis, shin splints, is when those fibers are damaged. Now, what about endosteum? So here's what I want you to understand, folks. Look, this is on the right, okay? This is a spongy bone. And spongy bone are quote-unquote trapped within the compact. Am I making sense? Yeah? So the surfaces of anything inside the bone, surfaces of a trabeculae or surfaces, inner surface of the medullary cavity, they are all covered in the thin connective tissue called endosteum. Are we doing all right so far? So here's the deal. Bone markings. My goal is not to read the table for you. My goal is to tell you what you need to take out of this table and to highlight certain terms that you must know. So first of all, we're going to start with articulations. So articulation is where two bones meet. And from now on, listen, we have various prominences. Take a look. Head, prominence. Condyle, rounded. Okay? Projection, raised. Protuberance, protruding. Process, prominence. Some kind of a protrusion. So take a look at this. For example, tubercle. You see there's a tubercle here on the head of the femur. Okay? Or crest. There's an iliac crest, which is the superiormost part of the hip bone. What do you need to know? Definitions of articulation in head. But then, what forms a projection on the bone surface? Any idea? Muscles. When muscles pull on the bone, they create projections. This crest, iliac crest, is the site of origin for your oblique muscles in the abdomen. So these are strong muscles. They constantly apply force to your hips, therefore crest. Am I making sense?
Could you repeat that
Question. What? Okay, so it's a rhetorical question. What forms those projections? Muscles. Muscles pull on the bones and form different projections. Whenever you see any of this, a spine, a tuberosity, a line, there's going to be a muscle attached. Does that make sense? Now, when you look at flat surfaces like a facet or a condyle, what can be there? Usually facets or condyles are places where bones meet with each other. Does it make sense? I'm going to give an example of a question that I can ask. Then we have things like fossa or fovea. Okay? These are the places where something is sitting. An organ or maybe a muscle is laying in the fossa. Okay? So if you look at your pelvis, well, not yours, but the pelvis, fossa is a flat surface. This is where our organs sitting. This is where some muscles are housed. Okay, and then we have depressions and openings. So, huh? like fissures, sulcus, canal, fissure, foramen, meatus, sinus. Now, will I be asking you the sort of match the term and the definition? Not really. I want you to have functional understanding. So, let me give you an example. The most likely term for a shallow part of the bone which houses a muscle will be, and you have a list of the terms, and you have to think, okay, we have two shallows, fossa and fovea, and I see on the list a fossa. That's a fossa. Or a nerve will most likely go through the bone via the following structure. I give you the answers: crest, line, fossa, foramen. So you think crest and line are extensions, protrusions, right? Fossa is just a flat surface, but foramen is the opening. So in a way, I ask you the meaning of those words, but I want a functional meaning. So not just don't memorize the words, imagine. Am I making sense? Like, imagine what this is. Which brings us to the development of the bone. And the first one we're going to talk about is, so this is the process that's called ossification. The first ossification we're going to talk about is endochondral ossification. Endo means inside. Chondral means cartilage. So this ossification starts within the cartilage. Turns out, human skeleton, when fetus develops, initially is not made out of bone. It is made out of hyaline cartilage. So here you see step A, hyaline cartilage that has a shape of a future bone. First, it calcifies. Okay? After that calcification, cartilage starts forming periosteum that surrounds it, and in the center of that cartilaginous shape, primary ossification center forms. Primary meaning first. In this primary ossification center, now listen very closely. Hyaline cartilage is replaced. I can't stress it enough. Cartilage doesn't turn into a bone. Do you understand what I'm saying? Cartilage doesn't develop into a bone. Cartilage is replaced by the bone tissue. So we start with the primary ossification center. Eventually, medullary cavity is formed, and only the ends of that interesting hybrid contain the matrix of the cartilage. So at some point within those ends, which we call epiphysis, secondary ossification centers are formed. Bone replaces the cartilage, and the only places, and after that replacement, there are only two locations where you can find hyaline cartilage in the epiphysis. One of them is on the surface, articular cartilage. Do you remember what an articulation is? Articulation is where two bones meet. It's a joint, effectively. So articular cartilage protects the bone. And the second place is epiphyseal plate, which is critical for bone growth. We are going to discuss how this works. Okay? Am I making sense? We're going to discuss how this epiphyseal plate promotes the growth of the bone in a bit. But we first need to figure out the second type of ossification, which is intramembranous. And again, think about the name. Intramembranous. membranous, inside of the membrane. So intramembranous ossification forms flat bones of the skull, such as frontal, parietal, occipital, and temporal, and the clavicle. So in that fetal skeleton, I guess, when fetus is very, very, very young, okay, skull is made of a connective tissue. It's a membrane. So intramembranous ossification is much simpler. Look, you have multiple ossification centers in which spongy bone is formed first. So the osteoblasts produce osteoid, osteocytes eventually are formed from osteoblasts, new matrix is deposited. So eventually this entire membrane is replaced with a spongy or trabecular bone. The final step is the remodeling of the outer layer of that newly formed bone into a compact one, and the development of the periosteum. Okay. So effectively you have an invasion of osteogenic cells that start forming bone cells which replace the membrane with the bone. And this brings us to interstitial or longitudinal bone growth. And we're going to talk about different zones during the bone growth. So we're going to start with the resting zone. So this is the reserve or resting zone. These cells are chondrocytes, and what they do, they produce matrix. I want you to pay attention to the orientation of this. Look, that way is epiphysis. So reserve zone is the outermost. Okay? So as matrix is being produced. Look, when these chondrocytes produce matrix, how do you think the thickness of the reserve zone changes? It increases, right? They deposit more matrix, right? So it becomes thicker. Now, at the very sort of bottom, bless you, on the very bottom of the reserve or resting zone, the chondrocytes actively divide. It's called the proliferative zone. When chondrocytes divide, they push the reserve zone and the entire epiphysis away from the center of the bone, from the diaphysis. At the bottom of proliferative zone, chondrocytes start to enlarge. It's called hypertrophic zone. So chondrocytes become bigger. We are talking about cartilage yet. So hear me out. When chondrocytes become bigger, the lacunae in which they sit also become bigger. Does it sound reasonable for you? Yeah? Yeah? Yeah. So these lacunae become bigger. And at the bottom of the hypertrophy zone, the matrix starts to calcify in the calcification zone, and chondrocytes die. So remember our conversation about the bricklayers? So chondrocytes being trapped, yeah? So I'm a chondrocyte, I'm being trapped within the lacuna, right? If I die inside of the lacuna and completely destroyed, what's left? just the space, right? So now we are left with a gigantic lacunae within the calcified matrix. And what happens next? At the bottom of that calcification zone are osteoclasts that destroy the calcified matrix, and osteoblasts nearby deposit new bone. Am I making sense? So I want you to understand that when osteoclasts die in the calcification zone, you effectively have sort of a blueprint for the future bone development. Osteoclasts and osteoblasts do not form like a new, they know what they're doing. They are simply replacing cartilage with the bone. That's all. Sounds good? Okay. So this growth is the one that happens during the childhood, spurts for real, during the puberty, okay? Who starts growth spurt first? Males or females? Females. Always females. I remember my shock when I started high school. I was tiny compared to my female classmates, and everybody else was. Everybody else who was male was tiny, okay? And then we caught up. And it ends earlier in females than in males. Why? What drives the growth spurt during puberty? Hormones. Which hormones? Estrogen in females, testosterone in males. Puberty occurs in females earlier. That's it. Does that make sense?
Is because of the transition of cartilage to bone.
Say it again?
Like the growing pain that you have?
No. No. Growing pains, it's sometimes called Sever's disease. So when kids grow fast, like seriously fast, the growth rate, actual growth rate of bones versus muscles and tendons may not exactly match. So it creates an extra tension on those tendons, and that's why it hurts. That's all. Okay? That's growing pains. Now, interstitial growth, longitudinal growth, ends. Agreed? We all stopped growing. Okay? Oppositional growth never stops. So oppositional growth is effectively bone remodeling, and it occurs throughout the entire life. Okay? So how does that happen? Osteoclasts remove the bone on the inner surface, okay? And on the outer as well. Osteoblasts secrete new bone. Understood? So look at this tennis player. It's a pretty huge effort. Those who anyone who ever played tennis knows that it's a lot of effort. So the serving arm of the professional tennis player will have thicker bones compared to a non-serving arm. Okay, now, full disclosure, I have no intention of taking my pencil. But when it's summer and I wear shorts, I usually don't take it weird. I have terrible ankles, terrible feet. Really, I have flat feet. It's been a problem my entire life. My left foot is much worse. I can't generate as much force with the muscles of my left leg compared to right leg because of the ankle just hurts, okay? A physician and the physical therapist, they sew those, shins. It's you can see that my left leg is thinner than my right. Because every time, if you look at me standing, I'm going to be loading my weight in my right leg because it hurts less. So I bet my right tibia is much thicker than my left tibia. Now, what determines where bone remodeling will occur? When and how? So, first of all, where is determined by mechanical stress. Okay? I already gave an example of that little bump on your middle finger. That's mechanical stress. Now, hormones regulate when remodeling starts. But there is one major regulator of bone remodeling, which determines whether the remodeling is happening in the first place, and it's levels of calcium in the blood. So, levels of calcium in the blood is always a priority. Does that make sense? So if you have hypocalcemia, low blood calcium levels, and you try to work out and build the, and increase your bone mass, it's not going to go this way. Calcium is always a priority. Maintenance of the calcium levels is the number one.
I have a question.
Mm-hmm.
So for the longitudinal, because it's the length, what determines? So my left arm has the nervous,
Mm-hmm.
and my left arm is shorter than my right arm. Why? Because it's a nerve thing, and why is it determining how long? The length.
So your question, whether the nerve damage can impact the bone growth, I don't have a competent answer, but I would not exclude that there is a nerve component. Okay? Also, this is the speculation. If you had this, when you had this nerve damage, I presume you could not use your arm. Right?
I still have it, but it happened.
No, yes.
Yeah.
Once you have the damage, that's what I'm saying. After the damage, your ability to use your arm was severely restricted. Right? Which means your bones in your arm did not receive mechanical signals that would stimulate or guide the growth, and muscles were underdeveloped. And I can't exclude that muscle produce some kind of an environment that stimulates the bone growth. But I would bet on the lack of not the lack, but very much reduced mechanical stress. Okay? I hope it helped.
Okay, now I got a question.
Uh-huh.
If you had damage, okay, like I had a cut on my arm where I had to have surgery.
Okay?
So that arm is shorter than the other now. But there was no bone damage. So
I don't know what the surgery was. That's not enough data. See? Like, I can't. I
so
can't.
is there something else that can make your arm not, or your limb not be as long as the other side?
Well, technically speaking, in every person there is a discrepancy in the left and right leg. They're slightly different in length. Every person. It may be millimeters, but we have slightly different left and right leg.
Okay, is that just the leg or the whole side?
No, just leg.
Okay.
Just limbs. But I bet there's some genetic factors maybe that will determine, developmental factors that may determine why people have shorter or longer leg or arm. Now, let's talk a little bit, we're nearing the end. Let's talk a little about the bone homeostasis. So, look at this. All spongy bones in your body, all spongy bone in your body is replaced every 3 to 4 years. Compact bone every 10 years. So, in 10 years from now, you will have nothing left of the skeleton that you have now. It's all going to be new. It's going to be remodeled. Okay? So remodeling is done by remodeling units, which are osteoblasts and osteoclasts. So you can see that's the best illustration I could find. This is your remodeling unit right here. So you have osteoclasts that destroy the bone, and you have osteoblasts that deposit the bone. Okay? Make sense? So it's like this is your osteoclasts is your demolition team. Osteoblasts is your construction team. So the deposition of the bone is regulated by mechanical signals for the most part. Calcification is regulated by the chemical signals. Okay? So remodeling happens all the time. Through your entire life. At different rates, but through your entire life. Now, remodeling is regulated by hormonal loop for calcium homeostasis. Okay? So calcium homeostasis is concerned only about blood calcium. It's not concerned with the bone resilience. Mechanical and gravitational force, they quote-unquote tell your units where to deposit new bone. Okay? So, how does calcium homeostasis, how does it work? Okay, so calcium is super important. Those are just few functions. With some of them you are familiar already, in which calcium is important. So, calcium homeostasis is regulated by parathyroid hormone. When calcium is low, let's take a look what happens when the calcium is low. Here, to the right. So let's say calcium levels drop. See that? Yeah? In response to dropping calcium levels, your parathyroid gland, which is located in the back of your thyroid gland, produces the hormone called parathyroid hormone, or PTH. What this hormone does, increases the activity of osteoclasts, so resorption. It stimulates the reabsorption of calcium from the urine, the kidneys, and it increases the synthesis of vitamin D. What vitamin D does, what vitamin D is essential for effective absorption of calcium from food. Are we clear? So, how to remember this? Think of calcium as money. Okay, let's say you run low on money. It's a hypothetical situation. What options do you have to increase your... Sure. Well, rob a bank is a viable option, but it's a bit too risky. Earn more. Hold on. Slow down. You can earn more, right? That's your calcium from food. Earn. What else can you do? Can you spend less? That's your calcium from urine. Can you tap into your savings? your bones are your savings account. Clear? Now, a little highlight. So this provides you with a list of options, okay? So osteoclasts can break down the bone and release calcium. Intestinal absorption and decreased excretion with urine. Now, intestinal absorption is indirect because it goes through vitamin D. How do people get vitamin D? Sun. Yes. Sun. You expose your skin to sun, your skin synthesizes vitamin D. How long should you, and how long and how much skin should you expose to get daily dose of vitamin D? 15 minutes, direct sunlight, stark naked. In the 15 minutes a day, direct sunlight, stark naked, the entire skin. That will result in a daily dose of vitamin D. Direct sunlight is a bit of an issue in the state of Ohio in general, and being stark naked, more likely to fly in certain areas, but in general, I would not dare to do it even in my backyard.
So
okay?
If you can produce
Yeah.
half of your body for 30 minutes, is that equal to the 15
Well,
minutes of your full body?
Well, think of how much of your skin is usually exposed. Not a lot. And you're not getting a lot of sunlight because, let's admit, we're all adults, we work, we're in school, we're inside. So, no. Are you familiar with those little, like, what should I call it? Like vitamins and other crap?
Yes.
Supplements.
Yes.
So,
Does it work the same way for like taking five supplements?
yes. So, first of all, a little bit about supplements. It's a scam.
What?
Yes, it's all scam.
No.
99% of supplements have absolutely no clinical proof of them working. I am very jealous that I did not come up with an idea because I want to scam people out of money and just retire early. So it's legal, But vitamins and any other supplements, except for very few, useless. Vitamin D is one of not useless, as well as calcium supplements. It is recommended that an adult will take a certain amount of vitamin D and calcium every day. What amount? Professional societies in America cannot agree. I checked endocrine, whatever society, internal medicine, infectious disease, they all have different recommendations. But basically, if you buy garden variety vitamin D in a supplement section, it contains enough. It may contain more than you need, but it's not a huge deal because it's maybe 2 times more. Okay? Make sense? Go ahead.
So when you see stuff, food that's fortified with calcium and vitamin D,
That is true.
I try to eat the food instead of taking the supplement.
Sure. Well, depends on what your diet is. If you're trying to lose weight and eat kale, you're not going to get enough calcium or vitamin A. You need to take. If your diet is normal, like there's a variety, you different foods, yeah, you probably get enough calcium and vitamin D from the food. Well, vitamin D not really. Garbage, all of them.
No, which ones you said are not? You said vitamin D.
So vitamin D, calcium,
What about vitamin E?
you don't need them. You get enough vitamins.
Iron. Yeah.
No. You don't need any of this.
What do you take it for me?
So again? Okay, hang on a second. If somebody has iron deficient anemia, that's a different story. That's a condition that you have to treat with a drug which would contain iron. If it's a supplement, so be it. For a healthy person, there are no benefits, period, associated with any of the supplements sold. The only one, say again?
They're not regulated.
They are. They're not tested for efficiency. They're tested for toxicity.
Well, they just had a bunch of protein powders that got tested for metabolism blood.
Sure. Yeah. Well, they probably cannot test everything for everything, but it's all regulated by FDA, but the stringency is much less. So, for instance, if you try to push a drug, you have to show the results of clinical trials. If you try to push a supplement, all you have to show is that people don't die when take it. You don't have to prove any efficiency. Make sense? So it's like seriously. Okay, so now we're getting into fractures. So hear me out. These are different types of fractures. I want you to know few critical, I don't know how to say, elements of fractures maybe? Categories, let's call them categories. So first of all, open versus closed. So this is open, this is closed. Skin is being penetrated. That's pretty horrible, right? Open fracture has to be surgically fixed. Then we have non-displaced and displaced. So non-displaced means that the bone ends are not out of alignment. Look at this transverse and spiral fractures here. Bone ends are not out of alignment. Am I clear? And then we have complete versus incomplete. So, complete fracture is like this oblique one, all the way through. Green stick, on the other hand, is the incomplete fracture.
Wait, you said incomplete is oblique?
No, incomplete fracture is when bone is not broken all the way through.
Oh,
So, a couple of examples. I'm going to use one of my kids because he had a bad luck of having fractures. So one time I broke his arm playing soccer. He had a growth plate fracture. Well, he was deflecting a penalty. I kicked the ball and he was deflecting and he broke. I kicked it really well. Anyway, so he had this growth plate fracture. Was the bone broken all the way through? Fracture of a growth plate. Was the bone broken all the way through? No. Incomplete. Ends, were they misaligned? No. Just a hairline fracture. So non-displaced, and it was closed. Okay? Another time he broke off medial malleolus. In the humerus, you can feel it here. It's funny bone. Here. He broke medial malleolus. It was a complete fracture. And it was a displaced fracture because the bone fragment came out of alignment and they had to put the pin in. Make sense? Huh? Cut it open, screw the pin into the bone. Oh, he was rock climbing and forgot what he was taught how to land if you fall, and extended his arm. Okay. How you treat it? The fractures, I mean. Reduction, realignment, and immobilization. The cast. Okay? Reduction can be closed when doctor will just, move the bones without opening the arm, or it can be open. So, for instance, for my son, it was an open reduction because his arm had to be open. Okay? Now, one of my favorite stories, which is 100% real, you can find it, happened when we were in Louisiana. So in the city of Shreveport, there's a church in downtown, which has a spiel, okay, on top of it. And it always seemed very funky to me. seemed not particularly well built, let's put it this way. One day, we had a hurricane. Not horrible hurricane, but, pretty serious. And some guy was driving in his Lexus through downtown by the church. Lo and behold, that spiel fell from the church. Like a huge, it's like 10 feet tall thing. And landed on the Lexus. Which you can imagine, it's like accidental shot at the moving target. Right? So it was a very, very unlikely event to happen. And Lexus was leveled. But the guy was not dead. And he was extracted from the car. The only bones in his body that were not broken were the bones of his cranium, the entire skull, and his vertebral column. Everything else, and I mean it, was fractured. Pelvis, arms, thorax, everything. Okay? So they brought him to the hospital. I worked in a medical center adjacent to the hospital, LSU Medical Center. And he went into surgery. And they basically,
Rebuild his whole body.
it's like, like a Lego. You know what? Not like a Lego, more like,
You gotta put the pieces back together.
Yeah, but they got pieces together
That's a lot of pieces.
he was in a lot of surgeries. But he put them together, and a month later, or 2 months, he was interviewed because he was released. He had to go through physical therapy, obviously, but he was complete, let's put it this way. And I read this interview. There's a photograph of him and all the surgical team that fixed him. In an interview, he was asked, like, what can you say? And he says, it's an amazing surgical team, and I think it's a miracle that I survived after what happened. And I really am thankful to God for, fixing me. And I think, first of all, God didn't hold a scalpel. There's a bunch of doctors. And second, if you get hammered like this by a speed from a church, I think that God is not on your side.
I think he should be crying out.
I think God was trying to teach him a lesson or show him something.
Maybe, but then God did not really teach him a lesson properly. Anyway, what happens when your bone is fractured? Remember, bones are very well vascularized. Okay? So first the clot is formed, hematoma, here, between two ends. Okay? So, if you ever broke the bone, wherever you break it, swollen, painful, and inflamed. Then macrophages arrive and start clearing the debris. And various cells from connective tissue, from periosteum, for example, fibroblasts, and cells from cartilage, and osteogenic cells, they all create the cartilaginous matrix. It's called internal callus, and another name for it is fibrocartilaginous callus. The name means that this callus that I highlighted on the image B consists of cartilage and connective tissue. Eventually, osteoblasts start replacing that callus, forming bony callus, which consists of the spongy bone, due to osteoblasts. Okay? And eventually, that bony callus is remodeled, and your fracture is healed. Now, a very common question is, why, what determines, why is your bone the same shape? Because once the cast is removed, and you start using it, right, you use it for the same purpose. Like if it's your arm, you do the normal things for your arm, so that callus experiences the same mechanical stimuli, okay? And that remodels the callus in a way it is supposed to be. This is why it's not thin, it's not thick, it's just the same. Okay? So same mechanical stress determines why the fracture is healed in the same way. Well, this is the interesting conversation that we are about to have about various pathologies of the bone. Okay? Let's see if I can. Shit. Better. Okay, so let's talk about two diseases. One of them is pretty rare, the Paget disease. Okay. So Paget's disease, we don't know what causes it. Okay. Genetic, maybe environment. So basically what happens is this. Haphazard deposition of large amounts of mostly spongy bone, which means mostly in the joints, so hips, head, okay? Does that make sense? And it limits the movements within the affected joints or results in the disfigurement. I bet on genetics and hormones. Males of a particular ethnic origin are most susceptible. Now, another condition that you may see actually is osteomalacia and rickets. So the difference between the two is that osteomalacia is the disease in adults, and rickets is the disease in kids. The underlying cause, insufficient calcium. Okay? What can lead to it? What can cause insufficient calcium? One, low dietary calcium. You eat kale and nothing else. And another reason, vitamin D deficiency. Okay? Now, this is an opinion of a physician, pediatrician that was taking care of our kids. He said that, technically speaking, every child during their development goes through sort of mild rickets because kids grow so fast that supplying the necessary amounts of calcium is almost impossible. Am I making sense? But, it's not too bad. So, here in this image, you can see the sequelae, the consequences of rickets. Bones are not hard enough, and the body weight results in bowed legs. Okay? It may also result in deformities to the spine. You can see this child has scoliosis. Okay? But that's an old image. Now it practically is non-existent. Now this is the disease that you're going to see a lot. And osteoporosis. This is the age-related issue. Okay? So in osteoporosis, the resorption, the destruction of bone, outpaces the deposition. And the bone becomes brittle. If you look at the normal bone here, in this image, versus osteoporotic bone, you can see that within the spongy bone, it becomes trabeculae becomes much thinner, and thinner, and thinner, and thinner. Am I clear? Yeah? So, females are affected more by this condition than males. The reason for it is menopause. Turns out, estrogen, which levels decrease during menopause, is critical for bone deposition in females. Which hormone do you think is critical for bone deposition in males? Estrogen is critical in females. Testosterone. Now, do men experience the reduction in testosterone levels as they age? Yes. Yes, we do. But we don't have the dramatic decrease that is characteristic for menopause. Making sense? So, older men, like really older men, are more prone to fractures than younger men because testosterone goes down. But it's much more smooth, the decline. So what else can be a risk factor? Well, age, and being of a certain ethnic origin, specifically Caucasian. Okay? Having a petite body form and having sedentary lifestyle. Okay? This is a lot of other stuff, but you understand the term sedentary lifestyle? Couch potato? Remember how we're talking about bone remodeling? Yeah? For what stimulates bone remodeling? Mechanical stress. How can you put mechanical stress in your bones? By lifting heavy things off the floor. Exercise. Not just any exercise, I want to specify. Not just any exercise. Resistance training. Okay? So, well, how can we treat osteoporosis? If osteoporosis has settled in, treatment is not particularly effective. You need to prevent it. So the best osteoporosis prevention strategies, calcium and vitamin D adequate levels, and weight-bearing exercise. If you think whether or not you should go to a gym, think of it as you are creating a savings account for later. So osteoporosis, it's going to hit you, but it's not going to hit you as hard because you have that reserve. For some time, women were using hormone replacement therapy, which turned out to not be optimal because it significantly increased the risk of heart attack and stroke, and what's important, it drove breast cancer in many recipients. It's still applied, but just very careful. Some drugs, you don't need to know the mechanisms, denosumab and bisphosphonates. Now we have estrogen receptor agonists, special drugs that act like estrogen on estrogen receptors in the bone, but miss the receptors in the potential breast cancer cells. Okay, and prevention, exercise, no toxic habits, increased calcium, and reduced consumption of drinks like Diet Coke, because it's acidic and acid takes the calcium out of the bone, or alcohol. Okay? Alcohol acidifies the blood, so calcium is being taken out as well. Am I making sense? All good? All right. Folks, here,
With the ladies, the naked ladies.
this one?
Oh, the one about the first one.
The first one.
Oh, the bone pathologist. Hold on. The naked lady.
It said bone remodeling, osteomalacia, rickets.
Yes, here. Is that what you're looking for? Okay. Now, folks, let me stop it.